Sure. Motivational interviewing is an approach. It's a communication style. So it's not a technique that you try to use during an appointment with the patient, but rather it's an approach to communication on a whole. And in this approach to communication, you're trying to elicit the other person's motivations and bring about their intrinsic motivation to help motivate a change in their behavioral patterns. That's kind of the 30-second definition of motivational interviewing. It's not a singular event, but rather it's something that approach to communication that you carry across multiple visits. So for motivational interviewing, part of what you want to do, if we think about patients as being on a continuum in terms of stages of change, if a person has maladaptive behaviors around managing their pain, these behaviors have been learned over the course of time, just like substance use issues have been learned over the course of time. And if we're wanting them to change some of those things, that's great if we have that motivation for them, but the likelihood that they actually make those changes and adhere to those changes is going to be stronger if the motivation comes from within the person themselves. And so when a person is in a state where they have ambivalence, where they recognize something needs to change, but they're not quite fully there yet, they're not ready to commit to that, that's where motivational interviewing can be particularly effective, with helping to pull out some of that intrinsic motivation, reinforce that, and help drive that person to making those healthier behavioral changes. But they're not doing it because of you pushing the motivation on them, but rather they're using their own motivation, getting that reinforced through the interaction with the clinician to help move them into that healthier space. I wouldn't say it's been adopted across the board by psychologists only, but there's been a wide range of different clinicians who've adopted motivational interviewing in practice whenever there's been unhealthy behaviors to try to address, whether it be smoking cessation, if it's things related to diabetes management, cholesterol management, anytime there's behavioral changes that need to be put into place. And it's a wide range of clinicians that have adopted it. And it's been found to be effective approximately 75% of the time in helping to instill a change.